Hi, good afternoon, everyone. Thank you for joining today's webinar. My name is Nastasia Walsh. I'm a program manager at the National Association of Counties. I'm going to be moderating today's webinar. Thank you all for joining. This webinar is part of Stepping Up, a national initiative to reduce the number of people with mental illnesses in jails. It's a partnership between the National Association of Counties, the Council of State Governments Justice Center, and the American Psychiatric Association Foundation. We want to thank our generous sponsors at the U.S. Department of Justice's Bureau of Justice Assistance and other private and corporate sponsors who support Stepping Up. Before we begin, I'll go over just a few technical details to ensure that everyone can view the webinar correctly. This webinar is being recorded. It'll be posted on the Stepping Up Toolkit website for future reviewing, and you should be receiving an email tomorrow with the link to that webinar recording, so please feel free to share it. Also, to the right of your screen, you'll notice that there's a control panel. In this panel, there's a questions box. You can use this box anytime to type in questions if you're having technical difficulties, or if you have questions for the presenters, please go ahead and type them in there. If you have technical difficulties, we'll respond to you in that box, so keep an eye on it. And then during the Q&A session at the end of the webinar, I'll read the question on your behalf for our speakers. If you want to have a better view of the presentation, you can click on the small orange arrow in the top left corner of your control panel. So as part of the Stepping Up launch, the Stepping Up partners ask counties to join the initiative by passing a resolution or a proclamation committing to creating a sustainable plan to reduce the number of people with mental illnesses in your jails. So as of this morning, 425 counties have submitted resolutions to join Stepping Up. The counties are across 43 different states and represent about 130 million county residents, so about 40% of the U.S. population lives in a Stepping Up county. So we're really excited to have this momentum and to have folks just continue to be coming in to join the initiative. You can see a full list of the counties by state that have joined the initiative on the Stepping Up website. Just click on what you can do, and you'll see a map, and you can scroll down to see the states. You can also download a copy of the template resolution on this page. It's not too late to join. Just download a copy of that template, give it to your board, and then submit it back to Stepping Up. When you've passed it, we'll make sure you're added to the list of participants, and we'll make sure you're getting all of the resources that are available through the initiative. So really excited to have this many folks who are part of Stepping Up. So for those of you who have been with us for a while, we know that Stepping Up isn't about endorsing a particular program or model or strategy. It's really a framework for helping you to move towards your goals to reduce the number of people with mental illnesses in your jails. So to do this, we created the Stepping Up framework, the 6 questions counties need to ask. The 6 questions document was released in January of last year to help communities work through a process for creating sustainable change in your counties. And the hope is really that through careful consideration of each of these 6 questions as a team, and you can see the 6 questions up on the screen, we'll be able to determine what our counties need to have in place in order to have a systems level impact that really reduces jail populations, reduces the number of people with mental illnesses in our jail, and really increases public safety, applies resources effectively, and puts more people on the path to recovery. We know that some of you have been working on this for a really long time, some of you for decades, some of you are brand new to working on this issue and are just getting started. So the framework is really meant to meet you where you are. So don't worry if you're new to it or if you're more advanced. I think this process would be really helpful to enhance your efforts. So you can grab a copy of this report on the Stepping Up website, on the toolkit, which the website's up on the link there. You can download the toolkit. We also have webinars and things that I'll show in just a moment. The core premise of Stepping Up is obviously to reduce the prevalence of mental illness in jails. And to do that, Stepping Up suggests that we focus innovations on impacting one or more of what Stepping Up calls the 4 key measures, which are reducing bookings, length of stay, increasing connections to treatment, and reducing recidivism. So impacting one or more of these measures can help to reduce the number of people in your system. This webinar isn't going to go through all of the strategies that counties are using to address this measure in our communities, so I would definitely suggest looking at previous webinars case studies and reports that are available on the toolkit to get more information. And we'll be doing more programming on these 4 measures and how to collect data on these measures throughout 2018. So keep an eye out for notifications about that. And also, as counties move forward with your efforts, and we've seen a lot of progress from you folks over the past 3 years, but over the next year, Stepping Up is really going to focus on providing you as counties with the tools that we need to systematically identify people with mental illnesses who enter our jails. And the goal is to really have every county collecting accurate, accessible data on prevalence of mental illness in our jails, and then using this data to quantify the scale of the problem, to identify data-driven solutions, and to track progress on your Stepping Up efforts. So more to come on those resources that are coming up just in the next few months. And as a reminder, we do have this resources toolkit available. Over the past 3 years, the Stepping Up partners have cultivated this toolkit to help you with your efforts. On the Stepping Up website, you can access new and archived webinars, download that 6 questions framework report, review case studies that we've done on dozens of counties that are working on different aspects of this effort, as well as the latest research. And you can also get all of the archived webinars, including the 6 questions series. If you go to that website, you'll see yellow bars that have question 1, 2, 3. And so click on that and you can see all of the recordings for the webinars that we did last year in that 6 questions series. So all of these resources are free. They're available to help you be successful. I would definitely encourage folks to check out that toolkit if you haven't done so already. And then in addition to today's webinar, we have 2 Stepping Up activities and opportunities coming up in the next couple of months. In April next month, in partnership with the National Alliance on Mental Illness, Stepping Up will be hosting a webinar about the importance of engaging people with mental illnesses in your Stepping Up planning efforts. And we'll have some strategies for doing so effectively, including some counties that have been doing this really well. You can register for that webinar on the Stepping Up toolkit. And then on May 16th, hopefully you all got an email that Stepping Up is hosting a National Day of Action. So May of 2018 marks 3 years of Stepping Up, and May is also Mental Health Month. So to commemorate these 2 important milestones, Stepping Up is hosting a National Day of Action on May the 16th of this year. And during this Day of Action, counties are encouraged to host an event or participate in local activities to share with your constituents the progress we've made in addressing the number of people with mental illnesses in our jails. So raising public awareness and understanding of this issue in your community and emphasizing your commitment to creating some data-driven systems-level changes to policy and practice. On the Stepping Up website under events, and you should see if you go to the stepuptogether.org, you'll see a green bar at the top. We've posted a Day of Action toolkit that'll describe more about what the Day of Action is, why you should host them, some key strategies for getting the word out locally. We also talk about some potential activities. Every county's Day of Action is going to be different. We want to get you started with some ideas. If you haven't joined Stepping Up yet, or you're new to the initiative, this is a great opportunity to do so, to kick off some of your efforts. No matter what you do, we definitely want to hear from you. Post about it on social media. Use the hashtag #StepUpTogether, or I'm sorry, Step Up for Mental Health. I'll show that again. Tag us in your posts, send us an email with highlights and news articles about some of your events. I'm going to let our next speaker talk more about some communication strategies, since that's what this webinar is about, who can provide more and additional information on this. So I'll sort of jump into that now, but I hope that everyone will join us on May 16th for this Day of Action and host something in your communities related to your efforts. So here's the outline of our webinar today. We're going to be discussing communication strategies for helping to get the word out, not only with the media, with the public as well. You're going to hear from Fred Wong from the National Association of Counties, as well as Laura Usher from the National Alliance on Mental Illness, a Stepping Up partner. And you'll also hear from our presenters in Alamance County, North Carolina. So I'll introduce those speakers as we go along. First, we're going to hear from Fred Wong. He's the Communications Director for NACO, the National Association of Counties, one of the Stepping Up founding organizations. Fred joined NACO as Communications Director in 2017, where he leads the organization's media relations and messaging efforts. He was previously Public Engagement Advisor at the U.S. Agency for International Development, USAID, and worked at the White House in the Presidential Personnel Office. Earlier, he served as a speechwriter for the U.S. Secretary of Health and Human Services and in the Public Affairs Office of the Corporation for National and Community Service. So Fred, I'm going to hand it over to you.
Great. Well, thank you very much for having me here, and thank you all for joining today's call. I think it's an indicator of just how much progress has been made over recent years. And so we're very excited about May 16th as our Stepping Up Day of Action. And it's a great moment for us to look back at how much has been accomplished over the past 3 years, and the moments at which your counties have joined in stepping up. And so wanted to overview some of the different ways that you folks can get engaged. You folks that you're in your local communities are well aware of who your local journalists are who cover these areas, who might take interest in this. And so we created the Day of Action as a 3-year anniversary as a news hook for journalists and reporters and local covers of local news to get engaged. And so this is a moment where you can leverage that towards local action. So we recommend that you host a press conference, that maybe you have a service event, and so work through your local partnerships on who are the non-traditional actors who have joined you in your efforts, and maybe you folks can do something together that showcases the partnership, and also share your story of the different approaches that you have done to drive towards this issue, as it relates to what you've done with your local institutions and how they're reporting out new progress points that we should be very proud of and should be celebrating. And so towards that point, next slide, figure out your goals, develop your headlines, identifying your speakers and your audiences. All of these tools are things that you folks know how to communicate in general as county leaders, and so we suggest that you turn that towards your efforts on stepping up. Yeah, and so the key thing is that these are exercise moments for me and what I do as a communications professional. I also think of it as a good exercise moment wherein your coalition partners can really strengthen the bonds of your work together and strengthen the bonds of your collaboration. So we note that there is the earned media that you folks can get via traditional means, that is to say, newspapers, digital magazines that follow your local news. But you folks also have channels that are within your reach already, which is if you have Facebook, if you have Twitter, if you folks have other means of social media, those are things that you can leverage towards showcasing your efforts within your reach already. And so to that point, the kit that we shared on the invitation to this outlines a variety of social media handles and hashtags that you folks can use. We also provide some sample tweets and posts, and we'll be looking forward to toward the month of May on what kind of activities you folks want to do. And I offer myself up as a resource for thinking through what might work well. My contact information is provided here, as well as at the bottom or towards the end of our kit, we welcome you to submit your photos and as well as your coverage or releases to info@stepuptogether.org. And another key element is doing an op-ed. This is something that you can do that really shapes your ownership of the story. And another approach for that is also sitting down with your editorial boards of your local newspapers or your local television studios, and really walking them through what the issue is and the scope and your experience with it. Moving on. And the other element that we put forward is that you also have your blog posts that you as county leaders have within your means of being able to share your stories as well. Yep. Other ideas that we put forward is opening up a house or doing open houses or tours of your facilities to bring in reporters or to bring in other members of the community, and using that as a message moment and opportunity for you folks too. And with that, I point you to our resources that we already have on our website to learn more about them.
Great, thank you so much, Fred. I mean, I think what's really important to know, I mean, the Day of Action is one day of all of your efforts, and we know that you folks have been working on this for a very long time and have already started to doing some of this engagement, like Fred was talking about, with doing op-eds and reaching out to your local media and creating messages and setting goals for how you want to work with the media and work with the public to get your perspective forward. And so these are some tools to help you look at some of those communication strategies, to develop your messages, to identify folks. And you know, the Day of Action toolkit has a lot of sort of in-depth information on how to get the most media coverage, and also more information on those different types of events that you could hold. Like we talked about, I think partnering with folks like advocacy groups. Since it is Mental Health Month, we know that, and I think you know, Laura next will talk about this a little bit. You know, NAMI and its members, its local and its locations host a lot of events and walks to raise awareness of this issue, and so that's a great place to tap in with folks. So it's also a really great opportunity for you to showcase the relationships that you've been able to build between your county commission, your law enforcement, your sheriffs, your behavioral health systems, your housing systems, your advocacy groups, and to really showcase that this is a county-wide partnership and that these are great things that you all are doing, and show some of your accomplishments. Maybe you have, you know, the opening of a new mental health center that's happening. You know, maybe you do a press conference on the steps there for your Day of Action. Maybe you know, participate in a walk or a 5K. You could bring the media in and do a tour of, for example, your jail or a community mental health center. There's a lot of different opportunities and ways to get the word out on this, and to continue to get the word out beyond that Day of Action, because we do want you communicating about your efforts in order to gain more support from your community, raise awareness of this issue, and really make sure that you're celebrating the successes that you are having and getting more folks on board. So we hope that you'll look at these resources that are available. They're available on the Stepping Up website, like I said, under that green bar on the events page, so you can download the toolkit there. The Media Relations, a guide for counties, is really sort of a great resource for how to get a meeting with an editorial board, how to write an op-ed, who the audience should be, how to set up a press conference, who should be invited, and how to write a press release. And so we really encourage you to check that out. It's on the NACO website. You can also sort of just Google, say, Media Relations, a guide for counties. It's probably the fastest way to find it. But really encourage you guys to use those resources as ongoing in your communication strategies, not just for your Day of Action on the 16th. So, and we look forward to hearing from it. Like I said, here's that hashtag that I was saying, hashtag Step Up for Mental Health. Use it on Twitter or on Facebook or on YouTube. We'd love for you to post videos and pictures of what you're doing so that we can see, not just on May 16th, but ongoing. I for one, am an avid Twitter user and love to see what counties are doing. So please, you know, tag that whenever you're doing some cool stepping up things in your community, and we'll keep you engaged. So thank you so much, Fred. I appreciate it. Now we're going to hear from Laura Usher. Laura is the Senior Manager for Criminal Justice and Advocacy at the National Alliance on Mental Illness here in the Washington, D.C. area. In this role, Laura partners with leaders in criminal justice to advance NAMI's criminal justice priorities, including reforms to policing and jails. In her 11 years at NAMI, Laura has promoted Crisis Intervention Team Program, CIT, written public policy reports, worked with state and federal advocacy teams, and really become an expert on police officer mental health. She enjoys sharing the personal stories behind the advocacy priorities we fight for, and enjoys even more helping people to tell their own stories. So I'm going to pass it over to Laura to talk more about how to share sort of the human side to your efforts and to make sure that folks are engaged. So Laura, I'm going to hand it over to you.
Thanks, thanks, Nastasia. And I'm going to apologize to everyone. I have a little bit of allergies right now, so my voice is a little bit scratchy. So I hope you all will bear with me. I appreciate the introduction. As Nastasia said, I'm with NAMI, the National Alliance on Mental Illness. We're the nation's largest grassroots organization of people living with mental illness and family members. And probably many of your Stepping Up initiatives are working with your local NAMIs in your community, but I'm just going to put in a plug for, next slide, Nastasia, for if you haven't yet reached out to your local NAMI, taking the opportunity for the Day of Action to use this as an excuse to reach out to your local NAMI and partner more with peers and family members in every part of your initiative. So not just in sort of the communication strategy, but also as partners in decision making, in reviewing policies, as a feedback loop about how effective your efforts are, and as a resource for information about the treatments and the treatment system and the jails in your communities, because our members really have a lot of expertise to offer and really want to be involved. I know that the theme of today's webinar is communication. So the reason that I mention this broader partnership and role for peers and family members is that the beauty of including peers and family members as partners is that once we are involved, we can be incredibly avid cheerleaders and put our numbers and our personal stories behind your initiatives. NAMI members become, we sometimes say we're dogged advocates, or we're just very persistent. So our members take these issues of justice involvement very much to heart and take them very personally. So we've been very supportive of these efforts and really want to, really want to be engaged. Next slide, please. So in terms of communicating about your Day of Action and also just in general about your Stepping Up initiative, I would say one of the most powerful things you can do is share the personal stories of the individuals who are incarcerated or have been incarcerated and their family members. There are lots of people who would love a chance to tell their story and to feel like maybe the horrible experiences that they've been through could benefit somebody else and help improve the system, or help to educate the broader community. The gentleman in this photo is Ray Lay. He's from Indiana, and he's been incarcerated for a significant amount of time, but is out now doing extremely well. He's a peer support specialist and works in the VA. And he allowed me to interview him for the County News magazine for NACO last year. And his story is just really remarkable. And I think he says it best that, if you want to know how do you treat somebody with a mental illness, you treat them like a person. And I think that's a theme that comes up over and over again, that people are scared of mental illness. People are sort of scared of the people that seem other to them. And so often it's just as simple as having that chance to either personally interact or hear that personal story that helps break down some of that barrier and some of that otherness. So my suggestion is to ask somebody like Ray to speak at your press event or at your town hall event, or to lead the tour of your crisis center. NAMI has a training program that helps people who live with mental illness present their personal stories in an effective way. So our local chapters are happy to help connect you with speakers who can share their story. You also, in the long term, you can also think about asking these individuals or family members to write an article for your county newsletters, to do a photo story about people who have come out of jail, kind of share their stories through visuals, or ask officials or members of the public even to meet peers and family members at a NAMI meeting or at your treatment program, just to kind of bring that piece of the partnership into the public light a little bit more. In addition, you can work with your local NAMI to help amplify some of the personal stories through our social media networks, and suggest some of our members for media interviews or some of those traditional media efforts. Pardon me. So there are lots of ways to engage people in sharing their stories, in sort of talking about the benefits of an initiative like Stepping Up for their personal lives. I want to talk a little bit about the messaging that you use and how you talk about mental illness. So next slide, Nastasia. Oh, great, thank you. So I think, the first issue, and I think most folks are pretty savvy to this nowadays. It's always great to think a little bit about how are you describing the people that you're serving as part of your initiative. And there are actually a lot of right ways to talk about this population. There are just a couple of wrong ways. Probably the way that people find most offensive is to say the mentally ill, or other language that kind of objectifies people who live with mental illness. So what we prefer is to say people who live with mental illness, or peers who live with mental illness or mental health conditions, family members of people who live with mental illness, sometimes clients of the service system. So there are a variety of ways to talk about people who are involved in mental health, but just to kind of have a little bit of awareness and dialogue about that can be really helpful to make your peers and family members feel welcome at the table, and also to convey the message that folks are more than their illness. They're whole people who can participate in the community and in community life. And then I think another thing when you're working on your messaging is, how are you describing your initiative's goals and your initiative's successes? And I would encourage you always to talk about the hope for recovery and for a better life for individuals who experience mental illness. So obviously, the measures for the Stepping Up initiative are pertaining to reducing the number of people who are in jail, and reducing the length of stay, and reducing recidivism and so forth. But for people who have a mental illness, it really comes down to, are they going to have an opportunity to have to experience recovery, to have a better life, for them to be reunited with their families if they have supportive families. And some of those kinds of experiences, I think, really resonate with people out in the public as well, who are reading the stories and maybe have never considered the possibility that somebody with a very serious mental illness could recover and could have could have a good life. So I think that's particularly why it's so important to share stories of people who are doing well and who have kind of achieved goals that they set for themselves. So related to that, I would also encourage you to think about when you're putting sort of the human face on people, to not just use the folks who are most easy and most sympathetic, but to think about folks who might have been stereotyped as being dangerous because they've been in jail. And we know that just because you've been in jail doesn't mean that you've committed a violent crime or that you have a high risk of being dangerous in the future. And so to kind of explicitly address the fact that most people who have been in jail or not with a mental illness are not necessarily there because of a violent crime, and to sort of break down a little bit of that negative language around criminality. If you want some inspiration about how to talk about the problems and some of the solutions in the context of personal stories, I'd recommend looking at the Stepping Up website, Step Up for Mental Health, and then the People section. There are a lot of stories there. I think probably you've all looked at the stories of individuals who are of a variety of players involved in this system, from police officers to mental health professionals to county commissioners. There are also a number of stories from people who live with mental illness and family members. And so looking at some of those peer and family stories to see how they talk about the problem and the challenges, but also think about sort of the hope that they experience too, might be inspiring. And then I would just suggest that when you're crafting your messaging for your community initiative, that you think about including some of your NAMI partners in your message planning, because they may have perspectives that they bring to the table that other partners don't necessarily think of right away, such as highlighting the role of peer specialists when you're talking about your services, or highlighting the role of family advocates or family navigators when you're talking about your partnerships. So there's just a variety of ways to sort of think about being a little bit more holistic about your message and including people with mental illness and their family members. Next slide, please. So I want to mention a couple of resources that might be helpful to you as you're thinking about how you message for the Day of Action, and also just down the line in general, how you partner with people with mental illness, with your local NAMIs. NAMI has a Mental Health Month website with a lot of resources on how to get out your message about Mental Health Month. And I mention this not because I want to create, a competition between the Day of Action and our Mental Health Month sort of messaging, but because the Mental Health Month messaging is very geared towards general awareness about mental illness. And there's, a lot of like pre-made graphics and social media messaging and fact sheets and so forth that just sort of provide some basic building blocks that you can borrow from and use and adapt that might be helpful either in May or down the line. The other resource that I want to mention is the fact sheet that lives on the Stepping Up Initiative website called 10 Ways to Engage People Affected by Mental Illness in Your Community. And that provides more of a comprehensive overview, not just related to communication strategy, but around how to partner with your local NAMI organization or other advocacy organizations that represent people living with mental illness and their family members, just to ensure their inclusion at every step of the process. And I think, as I said in the beginning, that sort of lays the foundation for a really good dynamic partnership when you really need to work together on communicating about the successes of your initiative and how excited you are to move forward. Next slide, please. So those are the main points that I wanted to make, and I am more than happy to answer questions at the end of the webinar, or to have you all follow up with me via email. So I thank you for the opportunity to contribute, and I'll turn it back over to Nastasia.
Great. Thank you so much, Laura. I appreciate it. I think, part of that conversation around messaging and the language that we use and being inclusive of individuals will really go a long way in helping to raise awareness of these issues and to reduce some of the stigma like you were talking about. So I appreciate that, those points, and also wanted to make sure and plug again, and I'll plug it again at the end of the webinar, that in April, we'll be hosting a webinar on how to involve people with mental illnesses in your Stepping Up efforts, and it'll really go through a lot of some of those things that are in that handout that you just described, and highlight some of the really effective ways that people have been engaging with those who are living with mental illnesses and their families in their efforts, and how it's really enhance the efforts that are happening in communities. So thank you so much, Laura, for sharing your presentation, and we look forward to continuing to have you and NAMI be a strong partnership in Stepping Up. All right, so I'm going to turn it over to our speakers in Alamance County, North Carolina. So we have two speakers from the county today. One is Bob Bird. He's the serving his first term as Alamance County Commissioner, being elected in 2014 after retiring from a 35-year career as a senior hospital executive in Alamance County. Commissioner Bird was one of the original organizers of the Stepping Up initiative in Alamance County. He's co-chair of the county's Justice Advisory Council, which oversees Stepping Up, and played a leadership role in organizing the county's first Leaders Summit on opioid abuse as well. He serves on the board of the North Carolina Association of County Commissioners, where he chairs the Health and Human Services Steering Committee. He represents the board on the county's Board of Health, the 20 County Regional Mental Health Authority Board, 3 public transportation boards, and several other boards and committees. So he's very busy. And then we also have Timothy Britt, who's the Chief Deputy of the Alamance County Sheriff's Office. And the Sheriff's Office is the largest law enforcement agency in the county. He's charged with general law enforcement duties and operating the detention center, the jail. He's been a deputy with Alamance County for more than 29 years. During this time, he's served as a patrol deputy in field operations, a criminal investigator, and many administrative roles, including supervising detention operations. The Sheriff's Office is a primary partner in the Stepping Up initiative nationally and locally with Alamance County Steps Up. And Mr. Britt is a member of the leadership team and subcommittee co-chair of the local Stepping Up efforts. So Commissioner Bird and Chief Britt, I'm going to hand it over to you.
Well, thank you, and thank you for allowing us to be a part of this today. And I'm Tim Britt, and I'm here with Commissioner Bird, and we're going to kind of go back and forth here. We think we have it worked out where we won't step on each other, but we're going to do this. Next slide, please. Okay, way we'd like to start. First of all, I think to talk about what we're doing, our efforts and strategies here in Alamance County, of how we're communicating this to our community, you got to know a little bit about us and where we're from and how we're doing that. This is our web page, if you go to that, and we're very proud of this. We built this with the help of our IT department last year in 2017, and have already received over 20,000 hits. And we're going to tell you a little bit about our county. We're not a really big county, so that's a big number for us. I would like to just, if you get a chance, I'm not going to go over today, but look at our vision statement, and it kind of goes along with what Laura was saying about envision a community that respects, supports, and embraces persons living with mental illness. And I think that's key to start with that foundation. Next slide, please. A little bit about Alamance County. I'm not going to read all of it, but so, like I said, you know who are. We're not Mayberry, but we're not far from it, about 60 miles. So Alamance County, we're located along the I-85, I-40 corridor in north central North Carolina. We have a population just a little less than 160,000. We're a relatively small urban and rural area. And we have a detention center here that has 476 beds, which includes an 80-bed annex. Some of that median household stuff you guys can look at when you have time. Next slide, please. bit about our jail. Like I said, in the month of July in 2016, we booked 476 new inmates into our detention center. Through the tools that we were using at that time, we identified 65 persons living with mental illness. I think what's key to note there is 42 of those persons were booked in on misdemeanors, so nonviolent nuisance type charges, and 40 of those were repeat offenders. The cost to house those persons during that month was $156,000 to our local community. I say that because we all know this is about the human toll and about people. But when you start talking dollars and costs too, that gets people that can, decision makers to the table to see what actual costs are. And I think one of the things that has helped us tremendously in our community is for the community to see how much we were actually spending, and that there were better ways to spend that money and get folks help. Next slide, please. A little bit about the Alamance story. Our sheriff has been championing this issue the entire time he's been in office, about 15 years ago. Our detention center is the largest holding facility of persons living with mental illness in Alamance County. Our county commissioners, at the leadership of Commissioner Byrd, adopted a resolution in 2015 for Alamance County to join in the Stepping Up initiative. We were one of 2 counties in North Carolina that were chosen to attend NACO's National Stepping Up Summit in April of 2016. One of the things that we think this helped us tremendously is we hired 2 co-coordinators through the sheriff's office to drive this initiative, to keep us on task, to move forward. And I'm going to let Commissioner Byrd speak to we have a very long history of community collaboration here, and Commissioner Byrd's going to speak to that.
Yeah, and it's on that foundation of community collaboration that we've got a lot of people engaged in our Stepping Up initiative. But for example, and maybe you have some of these in your communities, but our United Way has hosted and sponsored a group of human services agencies for decades, probably 50 or 60 or 70 years, and we call it the Community Council. That meets every month, and so people really collaborate there. Several years ago, we established just a collaboration of people, of executives, of agencies that deal in children's services, and we call that the Children's Executive Oversight Committee. And there's a lot of sharing of resources, helping each other out in grant funding and overseeing some of the community efforts that we're doing around children. Not too many years ago, we established through a community collaboration the Family Justice Center. And years ago, in the mid to late 1990s, there was the Office of Healthy Carolinians at the state level in North Carolina, which was responsible for going around the state and trying to entice counties to pull together collaborative partners, form coalitions around health and wellness activities. And we started ours before even the Healthy Carolinians office existed, and that office has now been disbanded, but we still have our health, we call it Healthy Alamance, it's still in existence, and it does the community health assessments every year and a lot of other projects. So it's on that foundation that we've built a great deal of engagement of the community in our Stepping Up initiative. So Tim, back to you.
Yes, sir. Thank you. And along the lines of the community collaboration, I think that helped us as well. We have a very strong collaboration between local law enforcement, the municipal, county, state, and federal agencies that have jurisdiction in our community, and that helps tremendously when we look at the jail piece. And we know that a lot of folks that are winding up in our jail are first encountered by law enforcement, and knowing that there are other options besides jail. Next slide, please. Okay, we believe strongly that putting a face, and I think this follows with what Laura said earlier, putting a face on the issue, really showing the human toll. We put this slide in there because when we first started, we conducted kind of looked internally and tried to find a case study that fit the problem we have in our community, and this is an example of that. This gentleman was booked 26 times from 2009 to 2016. All of those times were for nuisance and misdemeanors. Next slide, please. This is the same gentleman on his 26th booking. This inmate spent 711 days in pretrial custody. So for the average booking or arrest, it was 27.3 days. 23 of those 26 bookings resulted in a release for time served. So he was brought in on a nuisance charge and wound up spending more time in jail than he could have received, so the court orders him released. He had 39 negative incidents in custody, and we found that we spent in Alamance County $55,130 to incarcerate this gentleman. And this shows the human toll and the face of our problem. Next slide, please. So we said we got to do something different. So the last time this gentleman was in our detention center, we made sure that we followed him outside after time served. And we got him some wraparound services, made sure we followed up with him. What Stepping Up's all about, finding something different from jail. This is that same gentleman today. He actually sent me this picture last summer, and he's at the beach. We still follow up with him, still chat with him. But this has been our case study to show, and it's also been a great communication tool because we can go out to folks and say, this is where we are before we do something. This is what we can do if we work together to make a difference. Next slide, please. Okay, Commissioner Byrd's going to take over from here on how we got there.
Thanks, Tim, and good afternoon, everybody. So when we started our initiative, we did like we were asked. We adopted the Stepping Up resolution, and unfortunately, it got adopted on the consent agenda. So we missed a great opportunity for some press release around that. And it took us a couple of months to figure out that, gosh, we're supposed to be doing something, putting a group of people together to take some action. So our county manager pulled together about 4 or 5 of us that included himself and myself and our director of social services and the sheriff and our chief deputy sheriff here. And before he did that, he talked to each of us personally, the county manager did, to make sure that we were on board. And because not all counties is the sheriff on board, but as Tim mentioned earlier, our sheriff has been championing this cause for a long time. And boy, was he ever on board. And so that really helped a lot. But so we sat around and asked ourselves, who else do we need to get to the table? Because we need to get more people involved. Next slide, please. Next slide. Okay. And so we've had a few iterations of this. The first group we invited to the table, it was probably about a dozen people, maybe, of different folks, and we looked at some of the materials from NACO and started discussing some next steps. And we decided, we need to have more people at the table. And after 2 or 3 iterations of that, we ended up having a very large group involved. And we decided to call that our task force. I'm going to talk about that more in a minute. But then we decided, look, we're going to have a core leadership team, which is a pretty diverse group when you look at the list. And I'm not going to read it all, every name there, but different people from different parts of our community to actually lead this initiative. And so that team has been meeting monthly until this past fall, and it morphed into our Justice Advisory Council, which I'll talk about in a minute. But next slide, please. But this, this is the Justice Advisory Council. So we had a grant from the Department of Justice, the Bureau of Justice Assistance, to help us with our Stepping Up initiative, and primarily to get our law enforcement officers trained in crisis intervention and to get our co-responder program going in our sheriff's department. And one of the requirements of that grant was for the community to have a Justice Advisory Council to oversee this process. And we created, as I mentioned earlier, a Family Justice Center a couple of years ago, and that had a steering committee, which was composed of a lot of the same people that we wanted to be involved with the oversight of the Stepping Up initiative. So we decided, well, let's make that the Justice Advisory Council, and that'll be responsible for both the Family Justice Center and for the Stepping Up initiative. So 1 month it'll meet, and it'll just deal with issues with the Family Justice Center, and in the alternating months it'll be for the Stepping Up initiative. And it actually expanded our base for the leadership team a little bit, so you can see all the various people. We have every police chief involved in the Justice Advisory Council of the municipal police departments in Alamance County, and they're committed to 100% of their officers being trained in CIT. But the point of this is we're getting a lot of people involved in both the leadership and in the implementation of the Stepping Up initiative, and that in and of itself is a great communications strategy. So next slide, please. And by the way, the Justice Advisory Council is an official county entity now. It comes under the guise of the Alamance County Board of Commissioners, and the commissioners actually make appointments to certain of the members of the Justice Advisory Council, and then the rest of them are ex officio appointees. So, but this broader task force that I was talking about, when we have a task force meeting, and we meet about twice a year, we typically have 70 or more people attending, and it represents a broad base of human service organizations and certain individuals and certain organizations that you can see there. Even other elected officials and school board representatives and our hospital executives and United Way's there, and just lots of people. And those meetings, they usually last 2 hours or so, and the discussion is so rich, and people are involved, and this serves as a great pool to draw from to participate in the committees that we have structured with our Stepping Up initiative. Next slide, please. So when we talk about developing community support, we're really talking about how we've done it here in Alamance, is just getting a lot of people from a broad backgrounds to actively be engaged in this. So I mentioned the Stepping Up Advisory Council and the Stepping Up Task Force already. So one of the things that we did was to even open it up to more people to figure out how a person who has mental illness, what's the process by which they end up in jail. And so we call this a community dialogue to map the process, to identify gaps that we have in the community, and then prioritize the findings. And that was an all-day event, and it was facilitated by the Department of Social Services at the University of North Carolina. And the quote, community dialogue, that's their brand, that's what they brand the process that they took us through. But we had probably about 90 people participating at that. Some of them were people that were already as a part of the task force, but we had others involved in that process too. So we developed early on some committees and subcommittees that kind of parallel the activities that were described in the NACO sequential intercept model. And but these are opportunities to involve even more people. So, for example, we have a community service capacity and sustainability committee, and with that, we've got 3 subcommittees, one working on a reclaimed pharmacy, one working on a diversion center, one working on identifying and managing high utilizers. Then we have another committee of dealing with the first responder training and community education, and another one on our detention center screening, assessment, and treatment, and yet another one on recovery and reentry strategy. So more opportunities to get more people involved. Next slide, please. And in our Board of Commissioners meetings, we take opportunities to make reports anytime there's some major updates about what's happening in our Stepping Up initiative. So we've been on a few field trips, and one field trip that we did last fall was a big one. We had probably about 16 people visit San Antonio, Texas, because they do such a great job with this initiative there. And we learned so much. So we had everybody that went on that trip to report to the Board of Commissioners, and of course the press was there, and that was just an opportunity to get the word out to the general public. When we get a grant, like the Department of Justice grant, we make a big deal out of that. We just recently got a $1.2 million grant from the Mental Health Authority that covers the 20-county region, including Alamance County. So that was another great opportunity to get some press coverage. And of course, those are on our commissioner videos for people who watch those. And we've been doing a lot of community presentations. We have somewhat of a speakers bureau where we go out and talk to civic clubs. We've been invited to talk to the Board of Education. We haven't set that up yet. We've spoken to the community council that I mentioned a little while ago. We've spoken to our local NAMI chapter. And by the way, NAMI is such an important part of our initiative, and the local chapter president is part of our leadership group, and then other members of the chapter participate in our task force meetings. Chamber of Commerce and even present political party meetings. Everybody wants a speaker, so we take advantage of that and talk about stepping up. And I'll say in my own personal experience that when I speak, I get a lot of head nodding, and people are so interested in this and so supportive, and they want us to move faster because mental illness is so prevalent in our community and in communities across the country, and they're so appreciative that somebody is actually paying attention to people with mental illness and to their families. So to me, it's been a very positive experience. And then we already mentioned our website. The next slide, please. So Tim, let me turn it over to you, and you can talk about some of the things that you've been involved in.
Sure. So basically, to summarize this, because I look at our time too, what we'd like to say is we took this on the road. So we figured the more we could get out and champion this cause and the need for it and help, we were able to go. We called our presentation Serving a Life Sentence 30 Days at a Time, because we were talking about folks that are just repeatedly coming into our detention center, and really the only issue they had was they were living with mental illness, and that was not the appropriate place for them to be. You can see here some of the places around our state that we've been, and it's helped us tremendously. So these stories have caught fire, so to speak, and it's generated a lot of talk and a lot of help. We actually have citizens now that have reached out to us and wanted to donate land and give trust amounts to this cause and to help us. And so it's really been great for us. Last slide, please. And Bob and I both will speak about this.
So, yeah, I'll just say that these are some of the success factors, sort of a summary slide. Getting the right players to the table is key, and making sure that you have really good broad-based participation. And one thing that we didn't mention is having paid staff to keep all the energy going. So we're really fortunate to have two part-time co-coordinators. They're working for the Sheriff's Department, but one is a retired deputy director of our Department of Social Services, and the other is a retired mental health professional whose career was in our Mental Health Authority and our Department of Social Services. But keeping everybody engaged, taking tours, going to conferences, having our monthly meetings, just really important.
Absolutely, and putting a local face on the issue of case studies, showing the impact to your specific community and county, and then sharing the responsibility for telling the story. Everyone to help us advance the message. Thank you so much.
Thank you.
Great. Thank you so much, Commissioner in Chief. Appreciate the presentation and all of the great work that you guys are doing in Alamance County. And it seems like you have done a really great job in a small community of really engaging your community members, as well as, getting support from folks at the state level and even the national level involved in your work. And so it's great to hear about, how you've been able to garner some of that support and how you continue to do so. So thank you guys so much for sharing. We do have some time for questions, so I'm going to open it up. If folks have questions, please feel free to type it into the questions box on your dashboard, your webinar dashboard. And if you have questions, I'll go ahead and read them aloud for folks. I'm going to start off with one question that came in. There's a lot of different communication strategies that are out there, whether it's doing a press conference or hosting an event or doing a meeting with a, editorial board. Any tips on how to determine, what is probably the most effective for the messengers that you have, or what's most appropriate for certain audiences? When should you do a meeting with an editorial board versus, having a wider press conference? And maybe we'll start with Fred, our communications director, on that one.
Thank you very much. So on that point, I think that the presentation that we just heard, there was a last bullet point that stood out to me, which is sharing the responsibility for storytelling. And again, I think that's a key point to highlight for you folks as county leaders and for folks who live with your neighbors and in your communities, that this is a community telling its story about how it's coming together. I think it was really inspiring to see how the folks in North Carolina were able to get a growing coalition. I think that speaks to perhaps what's happening across the country in terms of more people getting engaged. You'll learn more, other people get engaged, and so and maybe some of you folks are trying to wrap your mind around what data points you can share. Well, bringing everything together, I think it's the storytelling that is something that is worthwhile. And so, again, be sensitive to who your messenger is. Maybe putting them in front of a bank of cameras doesn't make the right sense. I think that Laura put forward the good idea of having perhaps some of your clients give a tour of a facility. I think that could be particularly compelling, giving them the responsibility or sharing within the responsibility for sharing their story of progress, sharing their story for growth, and allowing journalists to see that human element behind this work. So this is to say that you all have a range of tools before you and think about how to deploy your unique non-traditional messengers for your story.
Great, thank you. I don't know, Laura or the folks in Alamance County, do you have anything to add to that? How do you sort of identify those? What's the right strategy, or who's the right messenger for different audiences?
I don't know. They told me I needed to be the face, so not the person with mental illness face, but the face of the initiative. But I think the gentleman in the slide has been really the face. But we haven't done a press conference. We invite the press to our task force meeting, or to our community dialogue over there. And of course, they come to our commissioner meetings, and they do mention us. And they did a series of articles. So it's been kind of informal, but I think it's been effective.
This is Laura. I think maybe your strategy may depend a little bit on what you're trying to accomplish at a particular point in time, and certainly on your audience. So, for example, you may have a different strategy if you're trying to get the legislature to appropriate funds to help out your county, versus if you're just trying to raise community awareness about the program and the initiative. So those are kind of different approaches that you'd want to take for those. I'm not necessarily an expert on communication strategy, but from my advocacy hat, I would sort of start, for community awareness, sort of start softer with more personal stories, and but for a more legislative approach, maybe an editorial, and then with very targeted meetings with legislators, for example.
Laura, this is Bob Bird. That's an excellent point, and I forgot to even think about. We actually have a good relationship with our local legislators. For our state legislature, we have two House of Representatives and one senator, and we did meet with them, our leadership group did, and got them on board with our Stepping Up initiative, and they even wrote a letter of support for a grant application to the Governor's Crime Commission. And that's a key point, is to have your legislative delegation aware of what you're doing and get behind it at the state level.
That's fantastic.
The application, but for other reasons.
Great. Thank you all so much. I appreciate that. Well, if folks have other questions, we do have contact information for our webinar presenters. So thank you all, Laura, Commissioner Byrd, Chief Britt, Fred, thank you for your presentations. Before we go, I do want to find out some more information from folks who are on the phone. So we're going to do some polling questions real quick to see who is participating in the webinar today. Can we launch the first poll, please? Great, thank you. And how about poll number 2? Great, thank you. We'll launch poll number 3, but I want to let everybody know, so we've got about a quarter of folks on the phone who are from rural counties, about a quarter from mid-sized counties, and then about 40% of you are from larger urban counties. So we know that this is a big issue for our rural counties and our mid-sized counties, not just a large urban county challenge that folks are facing. So thank you all for joining and being part of the webinar. Great, and then we have about 70% of you who said that you've passed a Stepping Up resolution. So thank you so much for joining. If you haven't passed the Stepping Up resolution, or you're not sure if your county has passed the Stepping Up resolution, you can get a copy of the resolution on the Stepping Up website, stepuptogether.org, under what you can do, and you can download a template resolution, send it off to your county board of commissioners or supervisors, have them pass the resolution, and then submit that resolution to myself or to the Stepping Up initiative, and we will make sure that your county gets listed up there on that website and is included on the map, and then you get all of the resources that you have there. So we look forward. There's no deadline for passing a resolution. We collect resolutions. We get more and more every week. Like I said, we have got 425 resolutions so far. So we'd love to have you join us on that one. And if you're not sure if your county is part of that, you can see the full list of counties who have passed a resolution on the stepuptogether.org website. All right, why don't we do the last and final poll? Great. So it looks like about 80% of you said, yes, you're going to participate in the Stepping Up Day of Action on May the 16th. I'm really excited to hear that. We're excited to hear more about what you're doing. Please be sure to tag us, send us emails, let us know about what's happening with your county's Stepping Up Day of Action. Let us know ahead of time, let us know the day of, let us know after. We want to hear all about it. And for the 8% of you who said they didn't know what the Stepping Up Day of Action was, that is happening on May the 16th, and it's an opportunity to really highlight the work that's happening in your county and raise awareness of this issue in your county. You can get more resources on stepuptogether.org. You'll see a green bar at the top that says Stepping Up Day of Action, so go check out the toolkit and see what that's all about. And I hope that all of you will also join us on April 26th at 2 o'clock for the next Stepping Up webinar on engaging people with mental illnesses in your planning efforts. and we'll be able to talk more about key strategies and how to recruit folks to be part of your efforts to make sure that we're sharing the stories and that the innovations that you're putting together are really helping the people who are most in need of these services. Here's the contact information for your partners at Stepping Up. Please don't hesitate to contact any of us if you have any questions about the initiative, about the Day of Action, or anything that you heard about today. Just want to close by saying thank you again to our speakers for taking the time. Thank you to all of you for your participation and questions during the webinar. We hope to have you on future Stepping Up webinars. And please complete the follow-up survey that's going to pop up after this webinar concludes. We really appreciate receiving your feedback. And we've reached the conclusion of our webinar. I hope you all have a wonderful rest of your day. Thank you for joining.